When you think about the involvement and data management for clinical imaging, my focus has mostly been on research of clinical imaging. And of course, there's a lot of data management involved there. There are a lot of solutions needed that can actually improve the process there. But what is very essential is to make sure to be able to connect to IT systems properly. One of the problems in the healthcare field in general is there are many different IT systems from many different vendors, and to be able to do scalable research with these medical imaging data, you need to be able to plug into all these different types of IT systems. That's the first step. Then the second step is you need to be able to de-identify these images. And it's not just the identification of the pixels, but the identification of medical imaging data is actually pretty complex because you need to de-identify text-based information. You need to de-identify the pixel-based information that comes in the DICOM file. So this is your X-ray, CT scan, MRI scan, and so on. And then you also need to de-identify the DICOM headers that come in the DICOM file. So this is, social security number, name of the patient, and so on. So being able to de-identify all of that is not super straightforward and actually needs quite some development. Once you've de-identified the data, then you need to structure or standardize the data. Because it's a big problem very often when you pull a CT scan of the chest from a PACS system, you might as well, very often you could actually pull a CT scan of the abdomen or another body part. It's not always actually how it's indexed. So make sure to standardize this. So you need also algorithms to do that. There's a lot of misalignment in terms of DICOM headers that say, hey, this is a CT scan of the abdomen, and those kind of misalignments, that needs to be standardized. And then lastly, you need to be able to build a cohort of data that you can use for your analytics or for your research. So you need all these prior steps to be able to do that so that you can filter through, okay, I want to build a cohort of patients that are between 45 years old and 65 years old that have had a CT scan of the chest that have non-small cell lung carcinoma, for example. That's not very straightforward. These are the kind of solutions and tools that we actually need to be able to manage our data and to do high-quality, scalable research with medical imaging data. Looking at the future, the second part of the question is, I think it's going to be very important to not only have the imaging data here, but also be able to take into consideration other types of data. So you can think about medical records, where you can find information about what's the medication that this patient was using at the time of the exam. You can think about lab values and so on. So being able to get a full patient information is very important on top of getting longitudinal information. So it's nice if you have one exam of one patient, but very often you actually need the longitudinal information to have the follow-up exams that will provide additional information. So getting that full patient jacket, I think in the future is going to be very important.